Okay, let's talk about people who may have, as we get older, things happen with our mouth, our teeth, and that we may have teeth missing or teeth that needs to be pulled. And I think one of the fears for individuals who feel as though they have to have some teeth removed is that they may be in a situation where they're in the public and they don't want to go around with the tooth missing until something is put in its place. How is that handled when people are having teeth extracted?
Well, for most people, I don't think anyone would enjoy going around with a space in the front of their mouth. But especially for people that are in the public eye, judges and lawyers and people that do a lot of speaking, it can be arranged so that they don't have to be seen with a space there. If they have to have a tooth out, a temporary replacement can be made before the tooth is taken out. And it's done very simply by taking a mold or an impression of their mouth. It's sent to the dental laboratory where the tooth in question is removed from a model of the mouth which is made from this impression. And an appliance can be made to replace that tooth. When the dentist gets this appliance back, he can take the tooth out and put it in the mouth the same visit so that the patient can walk out looking pretty much the same as they did when they came in.
Oh, that's excellent. Very good. Now, will that be the permanent tooth they'll be placed in, or that stays in temporarily until?
No, that's usually temporary because whether the patient decides to get a removable replacement or a permanent one, the gum tissue around the socket of the tooth that's removed has to heal and shrink. And it usually takes a month or two for the tissues to shrink, and then that patient can get a permanent replacement. It's important to allow the tissues to shrink because once the replacement is made, you don't want anything to shrink underneath it. It would create a space between the tooth and the gum, and it wouldn't look too pretty.
I see. What are the different types of replacements that a person can have? Let's first talk about the different permanent types of tooth replacement.
Well, the permanent type of replacement can either be done as an implant or it can be done as a bridge. The bridge, most insurance companies do fund bridge work because they find that it's relatively affordable for them. And for a patient that wants to have a bridge done, if they have insurance, the insurance paperwork can be filled out, and the insurance can approve the bridge before anything is done, before any teeth are taken out. Once the patient knows that the insurance is going to cover it, the bridge is prepared the same day that the tooth is taken out. A little temporary bridge is made, put in the patient's mouth for approximately a month or two until the gum tissue shrinks, and then a permanent one can be made. When the permanent one is made, naturally, they still have their temporary to wear in the meantime.
Okay.
If it's an implant is essentially a little device that takes the place of the root of the tooth that's removed. It can either be made as a press fit where it's pressed right into the socket, or a screw which is screwed into the socket. It has a little cover screw which is flush with the gum line, and if the patient elects to have that type of treatment, a little removable appliance can be made to go over the implant. And the patient can wear that. Usually around 6 months it takes for an implant to osseointegrate or integrate with the bone. And after that time, the implant is very tight. The little cover screw can be removed and an abutment screwed into it and a cap made to go over that. and then it's permanent after that.
Is everyone a candidate for implant?
No, everyone is not. If you have certain systemic disease such as diabetes or severe periodontal disease, sometimes it's not wise. Probably the most leading cause of implant failure is smoking. Patients that smoke,
really?
Yeah, patients that smoke are not candidates for implants. I don't think you'll get more than a couple of years out of them before they start to loosen up.
Wow.
So that's usually the only patients that I absolutely say they should not do it. But they can get bridge work done, which is also permanent. And as I mentioned, most insurances cover that. Most insurances do not cover implants, and patients have to fund that themselves.
Wow. And what is the most desired service that people prefer? Is it the implants or?
It is. The implants are very successful. They have about a 98% success rate.
Oh, really?
What's nice about them is they preserve the bone. By having something inside the bone, it does preserve the bone almost like a natural tooth. And it prevents the bone from wearing down over a period of time. And that's why not only everyone in the profession, but a lot of patients prefer that. Not only that, but if you compare it to having a bridge done, a bridge is usually made by shaving down a tooth on either side of the space to make a cap. And it's made in one piece with a cap on either side of the space and a dummy in the middle, or a pontic in the middle. To have one tooth replaced, it requires an adjacent tooth on either side to have a cap made with the replacement in between. That's why it's called a bridge, because it bridges from one tooth to the other, and there's the span is a little replacement tooth.
So, if someone we talked about the bridge. So the bridge is the one that's removable.
No, a bridge is permanent. It's the cap
permanent.
Made on a tooth on either side of the space, are cemented on, and you don't remove it. That's permanent.
That's permanent.
The removable appliance is usually called. It's either called a removable bridge or a removable partial denture. And that one is an appliance that you put in and can function all day long with, including eating. But it's advised to take those out at night before bedtime and keep them in a cup of water, because it's not good to keep them in the mouth 24 hours a day. It causes a lot of irritation of the gum tissue under it if you do that.
Mm-hmm. Oh, okay. Let me see. So, and the removable bridge is the one that the insurance company are most likely to reimburse.
Yes, the insurance companies not only reimburse for removables, they'll usually reimburse for permanent bridges as well, as long as they feel patients are candidates for it. In other words, if the rest of their mouth is in relatively good condition, they feel that it's worth their investment. Usually, most insurance companies would want a bridge to last anywhere from 3 to 5 years before they pay to have it redone. And if the adjacent teeth are relatively in good health, there's no reason why patients can't have bridges for as long as 15 or 20 years.
Oh, so now why? And this, we talk about permanent bridge that will last 15 to 20 years.
Yes.
And so permanent. And why is it necessary to have the bridge changed after 20 years?
Well, if there's nothing wrong with the bridge, you don't have to have it changed. But over a period of time, porcelain may chip off it, depending on the dietary habits of the patients. We tell them not to chew on anything real hard like bones or things. because the porcelain that is put on the bridge is like glass, and it can chip. And it's chipped for traumatic reasons also. Most insurance companies know that even with normal wear, little chips out of the porcelain can occur, and for that reason the bridge may need to be replaced. But just to cut their losses, they want it to last at least 3 to 5 years, which I feel is pretty fair, because with most normal use, like I say, you can get 10, 15, or 20 years out of it.
Now, what's for the partials that they'll remove? Just putting them in water and at the end of the night is the best care.
Yeah, if you put them in water overnight, just before they go to bed, it's usually enough. What the water does is it keeps the plastic of the denture, the acrylic, moist. The acrylic of most dentures has little micropores in it. And if it's kept wet and those little micropores are kept filled with water, the denture stays fresh. If it's just left to air dry, like on a tabletop or something like that, or wrapped in a towel, once it dries out, the little micropores can harbor bacteria and odors. If the pores are sealed with water by keeping them soaked in water, you don't have that, and the denture stays fresh. And the dentures are pretty easy to take care of. They can be washed with soap and water in the morning when you get up, and they can be inserted in the mouth right after brushing the teeth. You find that the teeth on the denture develop little tartar deposits around them, because they can develop tartar around them the same as natural teeth do. When that happens, you can soak them in a solution of Polydent tablets, which are a little fizzy tablet that you can put in the water that fizzes that stuff away and keeps the denture clean. When too much deposits get on there and you can't clean it that way, it's advisable to bring them to the dentist, and the dentist can clean them, and they'll have a new denture pretty much when he gets finished cleaning all the tartar off.
And how often should one use those little tablets?
Well, you don't have to use it every night. Water is sufficient. But when you notice little deposits starting to form around the necks of the teeth on the denture, that's the time to start putting a tablet in.